think I was inspired to become a nurse. First of all, my parents gave me at a young age one of those nursing kits.
I think I just grew up wanting to be a nurse. I can remember playing a nurse when I was growing up, dressing up like a nurse, making nursing hats with construction paper.
I remember my grandmother, it was a second career for her. And I can remember as a little girl being in her house and her getting ready for work and putting on her starched white uniform with her white compression hose and her white shoes and the hat. Wore her hat to work every day.
Actually, when I was maybe third or fourth grade, I learned about Florence Nightingale in history class, and I thought, wow, what a cool lady. She's so kind and altruistic and very giving of herself, and helped all these soldiers in the Crimean War.
I think it was probably my father who advocated nursing. He raised me since I was a young child. And when we would fly together in an airplane, he would tell me that I needed to learn how to land the plane in case he had a heart attack. And so I thought, oh boy, well I better learn how to land the plane and then, figure out how to prevent Dad from having a heart attack. And so I'd go to the library and I would look up his symptoms and, I'd say, Dad, I think you have, congestive heart failure.
From a small child, I've always been that person that is looking after people, whether it was a small cut on the finger, putting a Band-Aid on it, someone, vomiting or what have you. I didn't shy away from that. That didn't bother me at all.
When I was much younger, there was what we call the Biafra War in Nigeria, and seeing all the first aid workers running in to help people, I used to watch that, and that kind of fascinated me. I would look at the faculty. They had the prettiest faculty in the university, and I thought maybe one day I could be part of them.
So I worked part-time on the weekends at our local hospital there, and I was so inspired by a lot of the nurses that I saw there who really ran the hospital largely.
Because I really wanted to be a social worker, and they put me in L&D, and I didn't even know what it meant. And within 5 days, I delivered my first baby. I tell everybody, I don't know if I delivered the baby or if I pick it up off the stretcher back then, but I put the baby in my chest, and I was devastated, and I knew that's what I had to do for the rest of my life, and that's what I've done for the rest of my life.
Now, my sister-in-law and brother-in-law are both nurses, and they're both very passionate about their jobs, and I always admired that. They had the most wonderful stories to tell whenever we would go on vacations with them, and I always thought, maybe someday I would like to be a nurse. I wasn't sure I could, but I did, and I graduated when I was 40.
I actually became a nurse as a result of going to a program in high school way back when, in Health Occupation Students of America. The program placed me in a very large hospital in San Antonio as an aide, and I knew I wanted to be close to the patients. So that kind of got the thought process going.
I believe it was probably my father that inspired me. He is a retired anesthesiologist now, and that's our exposure to the medical world, is stories from him, tagging along with him to the hospital.
Growing up as a child, I took care of a lot of people, whether it's my grandparents, uncles, aunts. But when I was in 5th grade, my father actually figured in a car accident, and I was not given the opportunity to see him, and I wanted to go to the hospital to see him. And he expired, he died, and I didn't see him. So that gave me the desire and the push to actually go into being a nurse and take care of other people.
My grandmother, who I spent a lot of great time with, had she had the opportunity, had wanted to be a nurse. I came from a generation where you could start looking beyond nursing and teaching as being the professions for females. And so I started looking outside the box a little bit, but the scholarship I won was for nursing.
My grandmother, who was 82 years old at the time, got diagnosed with cardiomyopathy and subsequently with lung cancer, and she came to live with us. So in the mornings before going to school, we got Grandma up, got her cleaned up, brushed her hair. So that beginning kind of showed me that I could be a care provider, I could do caregiving, and I could do it in a very compassionate way.
I had a sister that was microcephalic, so she was completely disabled. My oldest sister, as a matter of fact. And so I think I've always been a nurse. You know, it was everybody's responsibility in the family to help take care of her. Plus my mother had always wanted to be a nurse and had never had that opportunity. And as a matter of fact, my sister and I ended up in nursing school all at the same time. So she was getting her LVN as my sister and I were getting our RN. So I think it was kind of in my blood.
When I was a child, I went to a lot of medical appointments for some chronic health conditions, and I was very comforted by nurses at that time, and they showed so much compassion for me, genuinely. That really was inspiring to me. And then also in high school, I volunteered at Texas Children's Hospital in the NICU and dialysis programs, and I was again inspired and really amazed by the nursing care, the genuine compassion, and the therapeutic relationship building. And it was at that point that I realized that nursing was going to be my calling.